You're watching CTOM TV. Knowledge is power.
Claire wants to know, what questions should I ask my doctor now that I've been diagnosed with cancer?
Excellent.
Mm-hmm.
Yes. The first thing you want to do is really focus and make sure that your doctor understands, precision oncology diagnostics. That's a very important thing. And as you know, a PET CT is a standard indication for just about any cancer.
In other countries.
In other countries.
Not in Canada.
Well, some doctors here, there's many doctors that are PET CT friendly. So the first thing to ask is, can I get a PET CT? If your doctor says no right off the bat, if they say it's not going to provide you with extra information, then clearly you need to go look for a different doctor. A doctor that is not aware and knowledgeable of the benefits of PET CT is someone that is probably not going to be doing anything other than very basic standard care.
Yeah.
And so you need to have a doctor that's on the up and up. And that is, they may say to you, well, listen, I agree you should get PET CT, but I can't get it covered for you. That's one thing. But if they flatly deny and say it's not going to be a benefit to you, then they're either number one, lying, or number two, just not knowledgeable enough to be treating you.
And you brought up a point about the money there too. I've had conversations myself over this last decade with numerous oncologists who have said that they didn't recommend such a test or certain treatments to their patients because of the cost. In other words, the doctors were making the decision for the patient about what knowledge they were given, rather than letting the patient decide if they wanted to spend the money.
And without having financial information on the patient, which is pretty important.
So another answer to your question there, Claire, is you want to let your doctor know, even if you don't have a lot of money, you want to let them know that you'd like to know all the options and make a decision for yourself, rather than them deciding what you could afford or what to tell you about.
I think that's an excellent point. Thank you, Michelle. Yes.
What else, if anything else? Genetic testing, obviously.
Yes, you want to determine if they're open to working with results from genetic testing. That's very important.
And let's talk, for people who haven't showed up and watched a show or spoken with you directly, let's just educate them on why genetic testing is so important.
Well, it indicates targeted therapies. It indicates what drugs are potentially going to work for you and what drugs are not going to work for you. And it also tells you how aggressive your cancer could potentially be. We hear that a lot. We hear, particularly with prostate cancer patients, you'll do fine, you'll die of old age. You'll die of old age before the cancer gets you. But these doctors don't have the information to say that.
That's right.
They're going by an old grading system called the Gleason scale on prostate cancer. And it doesn't include genetic information. And we're going to talk a bit about that in multiple myeloma today.
Okay. Sounds good. And you mentioned in your answer just now about targeted therapies. For those who are just tuning in or recently diagnosed with cancer, just trying to learn as much as they can, tell us a little bit about what a targeted therapy is.
Well, you say it so eloquently. I'd love to hear your side of it.
Okay, well, you're the science guy, and I'm just the one who's read lots and spoken about this stuff. So let me try. So targeted therapy is a cancer treatment that's been specifically designed to target the mutated part of the gene in your body, as opposed to the whole cell, or like chemotherapy that targets all rapidly reproducing cells. So it can directly get at what needs to be attended to, which is the cancer-causing part of the gene in your body, and it doesn't give you, as a rule, the same side effects as standard chemo or even the wrong targeted therapy, which is why if your doctor's giving you something like immunotherapy or a targeted therapy without having done proper full panel genetic testing, they're still guessing about, they might get lucky, but they still are essentially guessing about how to treat you, which is why it's always so good to get that broad panel genetic test to start with. And that way you know exactly what mutations are involved in your cancer. And then your doctor can treat you with more confidence, and you'll have less side effects and a better outcome.
Well said.
Thank you.
And I think the third thing you need to ask for is you need to be very blatantly and ask your doctor, you're prescribing this treatment. What is my expected overall survival and progression-free survival? And
Okay.
those are basically, they're well established for every drug. If a doctor does not have that information, they should not be prescribing that drug. It's important to know why you're getting this treatment versus another treatment that may have less side effects, but a better efficacy,
Mhm.
or may have, less side effects and, a worse efficacy.
Mhm.
You want to make those decisions. You want to be able to say, hey, listen, I don't want to be sicker than a dog and live for an extra 2 weeks
No.
when there's a different option.
Yeah.
So you need to
extremely
ask that. And more importantly, you need to ask for the peer review studies that the doctor is basing those decisions on.
Yes.
And if they can't provide you with that, it's not science-based.
Or they just
It's
don't have the
statistic-based.
knowledge yet.
Well, it's
or they don't have
statistic-based, and
access.
that's probably a doctor that you want to pass on and move on to a
Mhm.
different professional.
Unless they follow up and do provide you with that
Yes,
study
and
after.
they do occasionally. Yes.
Yeah, because not everybody's going to know everything in the moment.
And if they don't want to do that, then are they willing to work with a cancer consultation service such as us?
Mm-hmm.
Are they open to that? Hey, listen, I don't know what's going on. I don't have time. I got, 1,000 patients. But by all means, if you've got a research company helping you, we would love to look at the data and see if there's something we can help you with.
Mm-hmm.
So just, have those open conversations.
Mhm.
Ask them, how long am I going to live?
Mhm.
Show me the data.
Mhm.
It's show me the data.
Can you clarify? You said expected overall survival, at least I think that's what you said, and then
Mhm.
progression free. What is the difference between the two?
So progression free, so when they do a clinical trial, let's say they take 100 patients. And they take those 100 patients and they treat them with a particular therapy. They give them all the same therapy. So then when they reach the 50% mark, where 50% of those patients it's called the median,
Okay.
if it median is halfway. When 50% of those patients have a disease recurrence, then they mark that on the calendar, and that is referred to as a progression-free survival.
Okay.
And it's in months.
Okay.
Now, some patients are going to live a long time. Some patients who are really sick are going to get that disease back much quicker.
Mhm.
So it's not an exact way of determining how long you are going to live. You may be in a high point. You may be cured. You don't know what's going to happen.
It's the
But you have
average.
a statistical average that you can use to guide your treatment decisions
Okay.
and compare against other treatments.
Right. Mm-hmm.
The other one is the overall survival, and that's the same sort of measurement that basically has it looks at survival rates rather than when the disease comes back. So how
Okay.
what is when 50% of the patients die in that. Now that's going to have a range, so it's going to have a high range and a low range, and you want to look at that because you may be in the high range or you may be in the low range or the middle range.
Mm-hmm.
That's important.
Some of those things you talked about earlier that you might get on a good genetic panel test, like the VUSs and minor allele frequencies and
Mhm.
things like that, those will have an impact on whether you're in the high or low range, right?
Totally,
If you
yes.
get the right treatment,
Exactly.
so your body will respond better if it's
Yes.
targeted for those
Exactly.
genes. Yeah.
Exactly.
Mhm.
And then you also want to look at response rates.
Okay. Tell
So
us about
overall response rates, that refers to if you have 100 patients and 27 of those patients respond, and respond is typically defined as something called the RECIST criteria.
that. Okay.
And RECIST has different responses. It has a complete response. It has a partial response. It has a what is
Complete, partial.
partial, and brain fog, stable disease,
Okay.
and then progressive disease, PR.
Okay. All right. So those.
So all of those are responses.
Got
And
it.
so what you want to look at is the PATH CR. That refers to pathological complete response.
Okay. That's the
PCR, it's called.
PCR. And what does that tell us?
That's how many patients get a complete response to the treatment,
Okay.
rather than just a partial response or stable disease. Now, if you're in late stage cancer, stable disease is quite important too.
Yeah. Just slowing
no-
things down.
Well, stopping things.
Mhm.
Yeah.
Well, yes. Thank you for clarifying. Stable disease, stopping things. So it's
Yes.
not progressing at all.
No,
Got it. But it's not gone necessarily.
It's not
in
gone.
that case.
No.
Got it. Okay. Thank you.
Thank you for watching CTOME TV. Subscribe below and stay informed.